Hi, I'm Greilyn Ortiz. This is my project based on vascular interventional radiography. I hope you can hear me. Um, so, I am going to talk about interventional radiography just to touch on it and then focus on vascular IR. Interventional radiography is a modality in which minimal invasive procedures are done. Um, it has a huge advantage over surgery, and it offers less risk. It is less painful to for patients. The pain, it's you know it's a procedure that is done faster in a lot of cases, and it is it involves less recovery time, which is a huge advantage over surgery. A lot of procedures that are usually done in surgery or can be done in surgery, um, IR is a great alternative because of all the advantages it has. Like I have said, offers the less risk, it is less painful for patients, and the less recovery time. Less recovery time, it usually is between 24 to 48 hours, which is great because you can be up and going after a procedure 24, 48 hours afterwards. Maybe not doing a lot, but a lot more than just being in a hospital bed for weeks. Um, so a C-arm is used in IR, which involves um, ionizing radiation because it is done under live fluoro, and you just like in an ERCP or endo, in one of those procedures, how it is guided by the use of a C-arm. um, IR, interventional radiography, is as well. So there are two kinds of interventional radiography. It branches out into cardiac and vascular. Now, cardiac, it's it focuses on procedures done mainly in the heart, and vascular, it is most focused on procedures that are done in the lymph nodes and in the blood vessels. So I did my project based on vascular interventional radiography, in which it has to do with the lymph nodes and the blood vessels, procedures done there. Um, let me see. So the two procedures that I did for my vascular interventional radiography project are cerebroangiography and UFE, in which it stands for uterine fibroid embolization. I will talk about both of them. So cerebroangiography, it is using iodine contrast um, to see the blood vessels of the brain. Um, and it's like mapping out uh, the blood vessels that go, like if you do it here, you'll be able to see one part of your brain. So it can be done bilateral depending on what the procedure it is that it's being done, or it can just be done on one side to map out one side of the brain, of the blood vessels of the brain. Um, for adults, um, they go into a what it's called a moderate sedation. But when it's about having a cerebroangiography or angiogram in kids to mid-teens, it's not about, well, they don't go into like moderate sedation. They go under general anesthesia, which is a lot less, which is great, you know. um um I'm nervous. um so the steps that are taking in this procedure are, it's based on, like, it starts off where the radiologist wants to go in depending on the patient and any conditions they might have. And so it can be done through the neck, or through the groin area, uh, through the neck, through the carotid artery, or the groin, which is the femoral artery. So either or, like whichever place the doctor wants to go through or starts off the procedure, it just depends on them. Um, a lot of them though go through the neck because it's closer to the brain. So what the steps that are done in cerebral angiography is, and first, well, yeah, a lot of these cases are done under sterile field. Um, they make an incision on the neck, then they do what it's called an arterial puncture, in which a stillet needle is used to puncture the carotid artery. And then after doing that, a guide wire is used to go in the artery, and then it's guided with light fluoro, which it would be our job to move the C arm to the area of interest wherever they want to go. Some of them just stay there, go a little bit deeper, um, and then keep on going with the procedure. So after putting in the guide wire and being at the area of interest that they want to be on, um, that guide wire is replaced with what is called a catheter. And with this catheter, that's when they go ahead and inject the contrast, in order to see under light fluoro the map out of the blood vessels of the brain. Now, by doing this, they're able to see whether a person has had a stroke, if there's any blockage, if there's any stenting that they can put in. They can put in stents, or let me see, or if there are any missing arteries. So that's important because you want to make sure that the arteries that are supposed to go somewhere in the brain are supposed to be there in order to take oxygen to every part of your brain. So that's important. um, so that those are basically the steps of a cerebral angiography, which is mapping out of the blood vessels of the brain. Now, my second project, I will show an image towards the end just because I wasn't able to have print out the pictures of every procedure. So I will show them towards the end, and I will also put them in canvas, all sided and pretty. But my second procedure, in which I did for vascular IR, is uterine fibroid embolization, UFE, and it involves cutting off the blood to a certain area of your uterus, in order to cut the blood supply to a tumor that may be in the uterus of a woman. So UFE, it's I believe it's a great option to have over a hysterectomy. Well, I don't believe. I think it's great, but it's like an alternative of having a hysterectomy, which is a surgically removal of your uterus. um I think it's a great option for women that don't want to just go ahead and have a hysterectomy because they may have a tumor growth on their uterus. And and I know that women that do have fibroids in their uterus, their symptoms are cramping, longer periods, heavier periods, and a lot of these symptoms after having a UFE, after having this procedure done, are they literally feel better after like 24 hours. So they feel a lot better, and they're feeling like more normal again, which is great because we women understand what that's like. um So a uterine fibroid embolization, it involves basically kind of the same steps, but a tiny bit different, in which instead of um, going through other places of the body, they made it. They make the radiologist makes an incision in the groin area um, to go into the femoral artery. So, and it's well, first it's clean, sterile. An incision is made, then um, using a stillet or a needle, there's the arterial puncture in which it goes through the artery, the femoral artery, and then a guide wire is used under life fluoro to guide the guide wire to go into the spot that the radiologist wants to see. Now, once they're there, and they go ahead and then replace it with a catheter, just like um, just like I mentioned for the cerebral angiography. Um, so after placing the catheter, an injection is made of the contrast to see the blood vessels of the area to make sure they're on the right area. After doing that, they inject tiny particles in which blocks the blood flow and the blood supply to where the tumor is. Okay. So by doing this, after they have blocked all the blood supply to where the tumor is, it so the main point of doing that is to block blood supply to the tumor. Now, when by doing that, it causes the tumor to shrink because there's no blood supply to feed it, so it won't grow, it will start shrinking. Now there are also risks to this. Every procedure has risks, and that can include infections and uterine necrosis. So but I think it's a great alternative before having a hysterectomy. See if it works, um, and if not, then a hysterectomy can take place. But usually it also helps a lot with symptoms that women are having. I will also show a picture of how the procedure is done and of an image of the before and after having a uterine fibroid embolization towards the end. Um, Now I'm going to talk a little bit about um, what I see vascular interventional radiography, um, what it's like. So I've been to endo and done ERCPs with techs, and I think that it looks a lot like interventional IR is kind of like doing an ERCP, except a lot of it is sterile in a sterile field. Um, it is done using a C-arm under live fluoro. You save images. The radiologist, has an assistant in which in this profession, you will not only be guiding the C-arm, but you will also be prepping the patient and, using obviously protection. So you'll be shielded because of ionizing radiation. Um, and you'll be prepping everything that you will need for that procedure. So that's the main difference, in which not only taking x-rays or images under live fluoro, but you will also be doing a lot more than just doing that. So you'll be basically the radiologist assistant, which I think it's cool if you enjoy doing the RCPs or surgeries. It's kind of like that, and I pretty much like that. So there are risks to any procedure done, and the question comes in play of, do the risks outweigh the benefits? And depending on what the procedure is and what the patient is going through, it can tell you whether if it's worth getting a procedure done like a UFE over a hysterectomy. which I think it does, but everybody's different. Everybody has an opinion. Um, so with that out of the way, I'm almost done. I'm gonna talk about the different pathways of studying for this profession. Now, ARRT offers a primary and a post-primary way of qualifying, of being eligible. Um, in order to become certified in vascular IR, you do need a license for Florida because you are working with ionizing radiation. Um, Florida doesn't, I mean, Georgia doesn't, Florida does. So, depending on which state you go to, um, you'll have to check for licensing. So, the primary pathway is basically about finding a college that offers vascular or cardiac interventional radiography, um, getting a degree, make sure you know that the school is um, has the right credentials, and that they give you clinical hours so you can do your comps, your out log in your hours, and also give you information to prep for the registry, because all of this is about passing the registry to become certified. So that's the primary way, just finding a college to do it, or like us right now, how we are in radiology, and we can just cross train. But that's part of the post primary, but that's just an idea of it. Like going straight to school to study for it, and then go ahead and take the certification for the ARRT. Now the post primary pathway, which I sort of mentioned it, is like having, like us right now, that we're going to become certified in radiology, we can cross train. It's three different ways, one of three different ways you qualify for the post primary pathway, in which you have to have earned an ARRT credential using the primary eligibility way, or like us, that we're gonna have uh, become certified in radiology. So we become qualified. Also, earned a credential from another ART recognized organization. And the third way, or one of the other three ways, is to receive a program director's permission to cross train. That's just, it depends where you are, or where you're working. That after a while, after working there for a while, if they want to, if they're willing and want you to cross train, if they need more people in IR, then you can volunteer, or they'll go ahead and ask if anybody wants to take it, um, take a chance to go ahead and cross train to then become certified. It's a lot of self-studying. That's one thing that I noticed. I did spoke to radiologists, to our RTs, not radiologists, rad techs, um, that have cross trained, both at Baptist South and at Memorial, where you cross train. Um, well, what they were able to cross train, and they're doing is self studying for the test, make sure they're getting their clinical hours and clinical comps in order to qualify and be ready, like have everything ready for the registry, and just be able to pass the registry to become certified. I did also speak to the imaging director's assistant at Memorial, and he said that before even being considered to work, or in IR or cross train, you need to be able to have worked there for at least a year, because it's obvious they want to see how good you are at radiology, make sure you have the skills needed already in that profession before you do anything else. And they do evaluations every couple of months to a year, Um, so so you must be there a while before you even consider to being cross trained, because you want them to get to know you, and yeah, you want them to get to know you. In order to do something else, you have to be good at what you're currently doing. Um, so another um when it comes to like education, I did search, and UF Health, Jacksonville, University of Florida Health, they do offer a vascular interventional radiography program, um, but they only accept one student every eight months. So it's a student per 8 month period program. So they do accept two students a year every 6 months. Their program starts. Um, but it takes, it's basically one student. Um, it takes 8 months to do the whole program. It does cost $3,500. And to apply, you must have a good resume, um, and write a 500-word essay, like basically saying why you chose vascular interventional radiography as a career path. They want to make sure that you're serious about it, and that makes sense. So at the end of the program, they give you a certificate of completion. They do make sure you get your clinical education and your structural education, but it is still a lot of self studying. All they do is they give you all the material you need. They have a few conferences, that for the AART you need 16 hours of education, which that's what they give you. Um, and basically you study for the registry and you go ahead and take it. Now, the last thing I want to talk about is the AART vascular interventional requirements. So what the website requires, I already spoke about the primary and the post-primary eligibility pathway. um, but in order to become certified, you need clinical education, which uh, um I believe is 960 hours, around that range, 900 something hours. um and other than your time, you also need comps. Just like we're comping in radiology, you need a comp on different procedures, and that is you have to comp on 200 repetitions of 61 procedures. So you need to do 200 comps from a list of 61 procedures. But you can only do like from repetitions. You can only do, let's say, for one procedure, you can only do it 20. You can only do that one procedure 20 times, and that's done so you don't always, just so you don't do all 200 repetitions of a procedure in one procedure. That's just so you have many different procedures that you can do 20 on each of the 61 procedures, um, which obviously makes sense. But you can do it in different kinds of way, and the ARRT PDF shows you all of the different ways that you can do it. So there are different ways of doing it. Other than your clinical education, you also need structural education, and it's the at least 16 hours. Um, at least 16 hours of education that is based on patient care, image reproduction, and procedures. So you can get this education if you're cross training. Um, you can get this education done in the hospital, because a lot of people come in and they teach you about what's new, and so you can get those signed off if you're cross training. But if you do decide to go to UF Health for vascular IR, they do provide those 16 hours for you. Yay! All right, let me show you really quick Um, the images. Okay, so you can always go back to it because I wasn't able to. I don't know if you can see it. Oh man. But this is for cerebral angiography, this is an image of the right and the left side of the brain. This is the carotid artery, and this is iodine contrast already inserted through the catheter to see an angiogram or a mapping of the brain. That would be figure 1. Um, Now, the second image would be this one, in which right here an incision was made through the femoral artery. It was guided to where the fibroid is, and with a guide wire, and then um, a catheter was put in place. I'm sorry. And then a catheter was put in place in which injected iodide contrast. This is basically how just the visual of the procedure, the steps of the procedure. And this is the uterus, the fibroids, and that's where iodine contrast is injected. Right here, this would be the third image. This is an image of the contrast already in there. So this is a before and after. Let me see which was the before and after. So this is in the arrows right here. I don't know if yeah. So this one has arrows. This is a little hard to do. So here it shows where the iodine contrast is lining the blood vessels that's going into the uterus, and over here is an after film. After image taking where there is they already blocked with the tiny particles that they injected through the catheter. You can't see the blood vessels there right here. So this is a before and an after a uterine fibroid embolization procedure. So that's about it. I hope I did great. I'm so sorry I wasn't able to be there. I hope it doesn't affect my grade. um but I'm excited to today's the day um to see about my new daughter. So if you do want me, Miss Osteen, to present in class on Wednesday this coming up week, I can also do that. But here's a video. I hope you were able to listen. Listen and make sure I'll have to check, make sure I you can hear me correctly. And here's a little bit of Puerto Rico. My husband used to live on the mountains. I have no Wi-Fi, which is great because I've never lived without Wi-Fi in my life, and this is a whole week of a new experience. Thank you so much for your time. I know it's gonna be like 30 minutes. But thank you, and I hope to see you next week. I'm excited of my new daughter, and I'll see you soon. Have a great week. Bless you.